So we're just here to have a brief discussion about utilizing long levers. So some of the basic concepts you want to understand when using long levers. The idea of using a long lever is to use some portion of the body that is distant to the portion that you're trying to move. So when making that statement, we could make the suggestion that under some circumstances, if you repositioned the patient's thigh, so say you created internal rotation and then you say turned the shoulders or the whole thorax or the whole torso, you could essentially use the shoulders, the shoulder girdles, as a long lever to get to the hip. So just as a general visual, we internally rotate the thigh, and then if the patient was sitting up, I could twist his shoulders, and that would then eventually put tension and torque on the hip. Now that's not what we're necessarily going to show here, but we're trying to show some general concepts. So the main general concept that we want to look at is, regardless of the long lever that we're utilizing, what we have to understand is that there are breaks in the chain, right? So if I wanted to use the leg, now when I say leg, anatomically the leg is the knee down, but when I use leg in a more colloquial fashion, I mean the whole thing. So basically hip to pelvis, or not hip to pelvis, foot to pelvis. I could create traction. Now it won't look as clean here, so I'm just going to shift to the other side. So if we take a look right about here, right, we look at this spot and we just keep our eyes there, I can create mild motion, right? Create some traction, create some motion at that area. So in this case, what I've done is I've left the entire lower limb more or less straight. When I do that, what we've done is the hip, really not so much the hip, the knee hasn't bent. So there's no major break in this chain. So we can essentially, in this circumstance, consider it as one long, almost stiff lever, while it isn't a stiff lever because there are still possible breaks in the chain through soft tissue and hard tissue. But what we get is essentially a stiff lever. And then if I pull hard enough, I can move some of the tissues in the lumbar region. What we want to understand is that whatever lever that we're using, what's going to happen is that as we move it, so whatever point we're holding on, if I'm holding on the ankle, motion is induced here, and then it's going to travel along the lever. And it won't go any farther than essentially the amount of force you put on it. Now, while that may not be a perfect explanation, what we want to understand is that if I pull gently, if we watch the knee here, right, obviously as I pull on the pant, right, I can create some tension through the pant, but what we want to do, just for the visual, is we can kind of wrap that up a little tighter. If we look here, I can get some small motion. If I pull harder, right, more force, more leverage, I can get up to the hip or the lumbar region. Right? There we go. What you need to, again, understand is that depending on how far you move that lever, how much force you impart to that lever, the movement will travel further along the lever. Now, going back to what I was saying about breaks in the chain, if we look at the leg as the lever to move the pelvis or to move the lumbar region, we can, again, essentially use it as a stiff lever, as I've shown, or we can purposely put it in a different position. Okay? So now we have to understand the dynamic that we've bent the knee, we've created flexion in the hip, and then in this case, the foot is on the table. That isn't of much consequence because I could just as easily lift it off the table. Some people will speak about the patency of the limb as a lever. So say there was a problem with the hip, they would want to correct the problem with the hip prior to utilizing the leg, the lower limb, as a lever to move the pelvis. I will say that that's not absolutely a necessity unless the patient feels pain. What we want to understand is that at a certain point, whether the hip moves well or not, it's going to get in a position where it binds. When that binds, the soft tissues around it have some tension on it. So the soft tissues that unite the femur and the pelvis have some tension on them. And then the next thing that's going to move is the next thing that's going to be pulled on by those soft tissues. So whether or not the patient's hip moves well isn't of much concern unless it causes discomfort or pain. But what I can do is if I take the leg or the lower limb and I push it across, right? So if we look here, right, if we just kind of look at the space between the patient and the table, that's hip movement. So in this case, I'm using the femur as a lever to work through the hip. right? So the movement ends about here. If I go any farther, so we get some soft tissue tug, soft tissue pull, soft tissue bind, and eventually, right, so again, the patient's shirt has kind of come loose, which is not an abnormal thing, but we look at the relationship between the patient's body and the table. So that's hip movement. As I move a little farther, now the pelvis and the lumbar column start to move. If we're considering patient positioning, this isn't necessarily the ideal position. Supine is not the ideal position to create rotation, but what it allows us to do is see how we can utilize a lever. Before the lever will pull farther or longer, it has to get into a position of some soft tissue bind. Now, regardless of which lever we would choose or use, we need to see this. It will move in its constituent parts up until such a point as you put enough soft tissue tension that you create some tension, some tug, some pull, some bind to move whatever is further down the chain. We can do this with the arm, the head, the neck, but the easiest to visualize this with, because of the size, is the leg, right, or the lower limb rather. But essentially, the key that I want to get across here is that when you're using a long lever, you have to understand that there will be varying normal anatomical changes or breaks in the chain of whatever lever you're using, and what you have to do to get beyond that break. And usually that break could be considered a joint or called a joint, and it is a joint, but in some cases there could be other situations such as injury. Regardless of what it is, there's something along that chain that would block the transfer of force until you put enough soft tissue tension through it to pull on the hard tissue appropriately. These things are all connected. There is no discontinuity here in any portion of the human body, at least when it's living and intact. What we want to do, though, is consider that we have to put enough soft tissue tension at each point where the lever could cause a change in motion or kind of cause a break in continuity of whatever you're trying to create, such that we do have to create enough soft tissue bind before we move the next piece in the chain.